Macmillan Cancer redundancies will impact vulnerable patients, says whistleblowers. We're going to read into this more from this exclusive from iNews, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an exclusive from iNews with the headline that Macmillan Cancer redundancies will impact vulnerable patients, says whistleblower. A fresh wave of redundancies are underway at the charity as costs soar, including cutting roles in its vital support line for cancer patients. Guys, while you're here, make sure you hit the like button and shares across social media so others are notified of this video. This is terrible news if it does come to pass. Now, this is saying what a whistleblower is saying. It's entirely possible that Macmillan Cancer may just come out and deny that they're doing any kind of redundancies. So, but if it is to be true, and it is a terrible state of affairs. Now, they do absolutely wonderful work, and there are many charities in the UK and England. In England in particular, there are many fantastic charities that do such amazing work, and to hear about one having to make cutbacks because of difficulties of financial constraints, it's deeply heartbreaking, because it means that less people are going to get support. More people are going to struggle. What's happened over the last 14 years is that many people have turned to charities, donations, gift banks and whatnot, because of how cruel the Conservatives have been when it comes to making life more difficult for people, because of what they've done to this country, what they've done to public services, what they've done to communities by cutting the fundings for councils, not having those community posts, not having some of the essentials here, and people who struggle with cancer. And I have no idea what that is like for anyone to go through that period of cancer, whatever kind of cancer it may be. Is incredibly traumatic, knowing that it can kill you, and you don't know, and sometimes you don't always know when it will, or how long you will have, or the chemotherapy that you might have to go through, or certain cancers which are so bad that there's nothing anything can be done to save you. I know I used to work with someone who had to fight not once but twice breast cancer, and luckily she's still well this day, but who's to say it won't come back a third time? Even with those victories, there is always that thought at the back of your head. And charities like these can really be a massive difference. Now, the person that I knew, obviously, she's doing very well for herself. She has a good job. She has family, all that kind of stuff. There are some out there who don't have friends, who don't have colleagues, who don't have that support. And this is where Macmillan can be that difference maker. It can be that difference maker for support. And if this does come to pass, it means less people are going to have that support. And I know the one of the lines here on this channel is that there shouldn't have to be charities. There shouldn't need to be charities. The government should be providing everything that people need in these. And you're absolutely right. But we are in such a mess that the government can't, as of right now, cannot be there for everybody. So we have to rely on charities, because the previous government, previous political party, decided that no, doesn't matter if you're struggling, you have to get on with it, and we're not going to help you. I hope that's not the same attitude with this Labour government, but yeah, this is very sad if this comes to pass, that is for sure, guys. So let's read what they have to say, guys. So Macmillan Cancer Support is set to axe around 221 jobs in the latest in a wave of redundancies, with staff working for its vital support line for vulnerable patients among those facing the chop. One of Britain's biggest and best known cancer charities, it has admitted it is facing financial pressures and needs to work differently and do fewer things, but do them better as it battles the current economic climate. Due to inflation, Macmillan has seen its costs go up by 25%, while its income has remained stable at around £225 million a year. Whistleblowers have revealed to the Eye that they do believe a fresh wave of redundancies, which is currently under consultation, will have a direct impact on vulnerable cancer patients, as almost a quarter of the proposed job cuts will come from Macmillan's support line, which is an invaluable lifeline to many people. Sources have accused Macmillan chiefs of failing to make public aware services are being cut while running an appeal on its website urging people to make donations. The appeal says funds will go directly towards the Macmillan support line without making them aware that the number of staff working for this service may be drastically reduced. Macmillan has said that its support line will continue to be available for everyone who needs advice, support, and simply a listening ear. So the support line will not change. They will not be doing anything to the support line. The Macmillan Cancer Support Line is a free, confidential service that offers support for people with cancer, provides specialist support including energy advice, welfare advice, financial guidance, and work support advice. But under the redundancy proposals for which the consultation period ends on the 19th of November, some of these services no longer exist, while others will be watered down, claim sources at Macmillan. One insider told the Eye that Macmillan's support line is one of the few services at the charity which has direct contact with cancer patients, and people come to it at the moment of absolute need and desperation when they feel there is nowhere else for them to turn. Staff working for the support line are distraught as they see it far more than just a job. They're doing valuable work to help cancer patients, and it is such a shock to see these people are going to be hit with redundancies. Almost a quarter of these latest 221 redundancies are proposed to come from the support line, with the loss of 48 roles. Staff are feeling so guilty and upset they feel that they are lying to cancer patients who ring them, as they are telling them to come back to them while knowing they may not even be there. One whistleblower says when you go to Macmillan website, it's on the very first page, it is asking people to make donations to the support line appeal. They are being asked to put their hands in their pockets to help cancer patients, while at the same time services like the support line, which help people, are being massively cut. It feels like we are being deceitful to people. It is awful as we are dealing with such vulnerable people who have nowhere else to go, as other services locally have been decimated. Some of these people are extremely poorly with cancer, maybe even terminally ill, who are struggling with fatigue and memory loss and having to navigate very complex systems. Without the specialist support they receive now from the Macmillan support line, where they will go, it's very frightening and upsetting. While the consultation is still ongoing, the Eye understands that the terms of Macmillan's support line, including financial guidance, which supports people with cancer with things like pension, insurance and mortgages, and energy advice team, which helps people being with heating during the cost of living crisis, are among those under threat of being axed. A letter to affected staff at Macmillan states demands for our services have surged, and we aren't reaching everyone who needs us right now, including people with the greatest needs. We must change how we support people with cancer so we can help more people now in the future. What this means for us in service is that we will remain committed to providing information as the support as part of our offer to all, but we need to adopt our services and how we work to ensure those are reaching people with the greatest needs. We can't afford to work in the same way and be there for everyone. Macmillan's cancer support later proposal to make around 221 employees redundant follows 156 roles being cut earlier this year and several rounds of job cuts in recent years. The charity has also made changes to its executive team this year, including creating 4 new roles. Its first Chief People and Cultural Officer, Engagement, Partnership and Finance and Operations Officer. Macmillan employs 2,119 staff on average last year and recorded a deficit of more than 30 million. It is anticipated that if the latest round of redundancies go ahead, the workforce will plummet to just under 1,500 people. The letter continues, we are facing significant financial pressures due to some of the highest levels of inflation. This isn't a problem unique to our organisation. Many others are in the same position. Thanks to our amazing supporters and fundraising teams, our income has remained stable. But the fact is that we will be needing to raise multiple millions more each year just to meet an increased costs we face. We have taken steps over the last 12 months to stabilise our finances and the changes that we are proposing now, and we will help secure for our long-term future. To rise to all challenges, we need to focus on making the greatest impact with the resources that we have. It will mean that we do fewer things, but we do them better and ultimately make a bigger difference to the people with cancer. However, staff working with Macmillan are unhappy at the redundancies being sought, as they believe they're being carried out in the wrong places, and say morale is at an all-time low. We all understand the rationale for reconstructions, but the worry is where they will prioritise their cuts. One Macmillan worker told the Eye, "We always thought that they would protect the services that are front-facing. Services dealing directly with cancer patients should be the least affected, but they are making cuts in the wrong place," they argue. One worker also said, "I've been at Macmillan's for years, and I cannot believe they are doing what they are doing to this organisation. It's being destroyed. Morale has never been so bad." One source has said money's been spent in the wrong places. It seems like senior managers are making decisions to cut vital services for cancer patients to ensure they keep their own high-paid salaries. If they are on high-pay salaries, they should be taking a bit of a cut. Just saying. Our priority will be ensuring everyone living with cancer gets the support we need. Our support line is vital of how we do that. And our brilliant advisors will continue to be just a phone call, email, or message away. This year, we are on track to support them even more people than we did last year, and we are confident that we are heading into new year. We'll be supporting even more people who need us. With more people living with cancer, there needs to be increasingly complex demands to surge, and we know that we aren't reaching everyone who could benefit from Macmillan's support. At the same time, inflation has increased our costs, meaning that we have to fight harder for donations, and we have a greater impact with every pound we raise. To ensure we can be there for everyone who needs us, we must work differently. Yeah, they're struggling. And I'm sure they're not the only charity that's struggling. That's why over the last year we've worked closely with people living with cancer, our colleagues, healthcare professionals and partners to understand how we can evolve to make sure everyone living with cancer gets the best possible care today and in the future. To do this, we must focus on where we can have the greatest impact on people with cancer and continue to work closely with expert partners to connect people with the specialist support they need. We have also worked hard to reduce costs where possible, including reducing the size of our organisation, and very sadly this means we have to make some valued colleagues redundant. Throughout, our priority has been to protect the support we offer to people with cancer. We are grateful to the incredible colleagues who have worked tirelessly to continue to do whatever it takes so that our vital work for people with cancer can continue. In response to advertising its support line appeal on its website, despite seeking redundancies from staff working for the service, the spokesperson said, "Every day our incredible Macmillan support line advisors provide confidential support and practical information to people living with cancer and their loved ones. This will not change. Our advisors will continue to be there for everyone who needs advice, support, or simply a listening ear." As a charity funded almost entirely by generous donations, the money raised through the support line fund will help us continue this vital support with people with cancer across the UK. Around 98% of Macmillan's income comes from fundraising and legacies. Fundraising events including everything from marathons and sponsored bike rides to its signature Macmillan coffee mornings. Macmillan gives specialist healthcare, information and financial support for people affected by cancer, as well as providing emotional, practical support and advice. It also provides mean test grants of £200 to help with the extra costs that living with cancer can bring. Chief Executive Gemma Peters joined the organisation in January 2023. She has said it is time for Macmillan to evolve again, and it's better, and that better is possible, but only if the charity works differently. They are not the only charity that are going to have to make these difficult changes. I'm sure they're not the only ones who are having to make these difficult changes, and it's really, really sad. There are many, many good charities out there, and some are getting more funding than others. Some are getting funding from big donors and whatnot, because there are some people actually who give a lot of money towards there are some wealthy people who do give a lot of money to certain charities that help keep them going and make a massive difference, some more than others. And without a shadow of a doubt, my heart goes out to these people and the work that they do. I'm going to put a link to their website in the description below, and a link to their donation if you want to donate and support them yourself. Do check out their website, do check out the work they do. I do recommend it because they're struggling right now, and what they do is a very important work. And that's not to take away from any other charity that they do, that anyone's in the UK do. There are some amazing charities that do some amazing work, but when you hear about one that's possibly making cutbacks that could potentially affect some patients, it's very disheartening to say the least, you guys.
So let me know what you guys think about this story in the comments section down below. Let me know you think about Macmillan Cancer. Has it helped? Have they helped you? Have you spoken to them? Do you have a story that you want to share with us? Please feel free to share it down in the comment section below. If you found this video informative, please hit the like button. Greatly appreciated. Share this across social media so others are notified of this video. If you haven't subscribed already, please consider subscribing because it really does help support the channel. So thank you all so much for watching, and I hope to catch you all very, very soon.